Hi, I'm Mike Gray and I work for Health Education England in the National Portfolio Office. I also sit on the planning group for NHS Project Futures programme, and today I'm here with Henry Wilson. Today we're going to share a lesson and a case study of post-COVID-19 and the last couple of months, how that's changed. Hi Henry, welcome.
Good morning, Mike.
Could you introduce yourself to the people watching this episode today, please?
Yes, my name's Henry Wilson. I am the head of admin and outpatient transformation at University College London Hospitals.
Great, excellent. Busy job, I would have thought, Henry.
It's been a pretty busy time, Mike, over the last couple of months.
I can imagine. So could you share the background to the case study with us today, please?
Obviously, it goes without saying that it has been a pretty challenging and unprecedented time over the last 2 months. And in response to the current COVID-19 crisis, we had to change a lot of things in the way the hospital works in terms of administration and outpatients. So that meant implementing new projects or sometimes expediting projects that we had already mobilized, but we needed to do something quickly in response to the crisis to keep our patients and our staff safe.
I can imagine an absolutely critical time in frontline services, and it continues to be so, I imagine.
Exactly, and at UCLH we managed to keep over half of our outpatient services running, even though we needed to obviously keep as many people at home as possible, both the patients and staff. And so the case study talked about one of the things that we changed to enable that, which meant that patients could still get the care that they needed, but we could also contribute to those government guidelines that needed people to stay at home and not travel and not bring people into the hospital unnecessarily.
Yeah, absolutely. Still actually providing a service at a critical time when actually still allowing those boundaries to take place. So can you tell us what were the key stages of the project you want to share with us, Henry?
Indeed. So at UCLH, we have about 1.2 million outpatient appointments a year, and we try to keep as many of those outpatient appointments as possible so that we can continue to provide care to our patients. And a really, really important part of this is at the end of each clinic, the clinician summarizes the consultation, they write a letter back to the patient and to the referrer, and this letter gets sent off to them. With many of our admin staff and clinicians and patients away from the hospital, we had to rapidly find a solution so that we could still continue to print and post letters to people so that they could receive this critical clinical information. So we actually had a pilot project running to send all of this documentation off-site. So a third party would print and post these letters automatically for us from, an industrial sort of facility that they've got. And so we rapidly mobilized this project. It was critical that we did detailed requirements gathering. We had to make sure that the workflows were correct. We developed a plan. Very, very important to that was communication, because this involved quite a significant change to the way that people did things. And we carried out a technical feasibility assessment. This involved our electronic health record system, our IT supplier, and this third-party organisation that was going to print and post these letters for us. And finally, we had to make sure that critical enablers, such as information governance, were sorted out so that the workflow was safe and secure.
Wow, absolutely tremendous, Henry. Very complex. The way you've described it there, I can just imagine that the sorts of conversations that need to be had at that time in order to get things done. And it sounds like a real challenge for you and the team. I imagine you had to draw on some of your project management skills to help with that.
It's interesting because usually this kind of project takes months to do, and especially when there's so many people involved, internally and externally, suppliers and partners. So one of the big challenges that we have from a project perspective was bringing people together, which obviously we had to do virtually. And we very much adopted an iterative approach to this. So it was kind of agile development and delivery at its best, where we did a lot of requirements, test, refine and fix in a number of iterations. We met on a daily basis. We used all the technology available to us to bring people together. And ultimately, this showed, what I very, very firmly believe about project management, and good project management is about great communication.
It is indeed, absolutely, which sounds simple enough, doesn't it? But when you've got everything else coming at you, and very difficult to forecast what's coming as a result of COVID, I imagine you came across lots of other challenges which challenge your own project management approaches to things. And looking back at the project, what were your key obstacles as a result of that, do you feel? What were the real blockers for you for that?
Behavior change was a key thing. So obviously during the crisis, people want to make things work. It's sometimes easier to get things done, but you still need to do a huge amount of communication and engagement, changing the way that people have worked. In some cases, probably for 30 or 40 years, the organisation had tried to do this before. We had a small pilot running for our patient appointment letters, but to do it at this scale with tens of thousands of clinic letters being delivered in a completely different way was significant, a significant challenge. We had to make sure that we brought people along with this, and it was made doubly difficult by the fact that we couldn't get people together and people were off-site and at home. So actually, we delivered this in about 3 weeks, and a lot of the time, each and every day, was making sure that we were doing really, really great stakeholder management so that people adopted this, they knew what they were doing, they understood the new workflows, and they were confident in the new processes.
Yeah, absolutely. No, that's a great. I can just imagine, and I imagine people listening to our conversation today can relate to that. So, if you were to start that project again, Henry, not that you'd want to, but what would you do differently? What do you think? What lessons have you learned and drawn on from?
I think the critical one is I would think about the business as usual a little bit earlier. It's really, really important, even from the very, very early stages of a project, to think about how you're going to operationalize something. And because we were doing this at such pace, we didn't focus enough on how would we make sure that teams eventually manage this process themselves at local level. It's really, really sophisticated, and it gives us capability that we didn't have before in terms of reporting, in terms of exceptions. But I found that the project team is still managing that even a few weeks after go live, whereas we should have thought about the design of that business as usual process earlier, so that teams locally and operationally were empowered to take that forward. And that's something we're working on at the moment.
And what positive effects have you seen? What positive impacts have you seen from your team, from the people you work with, and across the organisation as a result of COVID?
We've been able to keep our admin teams safely at home, where clinicians are running their clinics from home. We have clinicians running telephone clinics, virtual clinics, video clinics. They can do that in the safety of their own house, but
Yeah.
still make sure that we deliver this correspondence to patients. And sometimes it's really, really urgent and really, really important that they get it quickly. And actually, this new process is quicker than the way we used to do things. So our letters, on average, get sent out in less than 5 days, which is pretty unprecedented in the history of the organisation, which is great. It's great for GPs, it's great for other clinicians, and it's great for the patients.
And so what's next, Henry?
We're always looking for ways to deliver our services, administer the hospital more efficiently and effectively, in particular where we can digitize communications with our patients, because this helps, empower them, get them the right information that they need more quickly, and ultimately provide them with better care. So we've got a number of projects on the go looking at how we can use digital technology more effectively to deliver those services to our patients.
Fantastic. Well, I'm sure everything that you've talked about today will be something you can draw upon and work through. And it's great to hear the opportunities that have come up as a result of that. And I want to take time to thank you for sharing your case study and your lessons learned with both myself and those that are watching.
Thanks very much, Mike. It was great to talk to you and to talk about our experiences at UCLH. And hopefully it's given others a bit of food for thought. Thanks very much.
You too, Henry, you too. Now, there will be a link shared following this video of Henry's case study and other case studies that we've captured as a result of the impact on COVID-19. So please take time to listen to those, share with your colleagues, talk about them, and be curious. And thanks for watching today.